pick back up on the biological basis of memory and talk about Lashley and Thompson. So, first, what's important is to talk about an engram, which is a memory trace. It's something that we talked about in the last video when it talks about that structural or chemical change, something that is happening in terms of long-term memory formation that we can actually locate. So, like a memory trace. And so Lashley had this theory that that memories are distributed or stored throughout the brain. And so he believed that because they were distributed throughout the brain, he could take a rat, he could train it on a maze, and then he could actually destroy parts of the brain and then get the rat to forget where the how to actually go through the maze. And so the interesting thing was the underlying idea was in the right direction, but he was ultimately incorrect because he could never demonstrate the support for his theory. So every time he took a rat and he would have it learn the maze and then he would destroy a part of the brain, he could never get it to forget to run the maze. And so this is where Thompson came in much later. And actually, so Lashley, devoted a lot of his time to this, a lot of his work to this, and never was able to provide the support. Where Thompson came along, and when he classically conditioned responses in rats, and then lesioned their cerebellums, found that, of course, there was that memories for classically conditioned responses were impacted when he actually lesioned or damaged the cerebellum in the animals that he worked with. And so if Lashley had really focused more on the cerebellum, he actually would have been able to find more support for what he was saying. But Thompson was the one who found more of the biological basis of at least part of memory. And we know now that there are certain kinds of memories that are localized in different areas of the brain. And so those classically conditioned responses are very important. The cerebellum is very important to this particular area. Now, when we talk about how we process memories. Now, what's important is this idea of memory consolidation. And we've talked about this before, and we talked about this in terms of sleep, that memory consolidation is when we convert these new long-term memories into very stable memories that are ones that we can retrieve after a long period of time. And so what can happen is, for example, with concussions, is that we can actually disrupt this process of memory consolidation, and this can cause a problem in remembering. And so if we look at a person's head, for example, here, okay, and then we have the person's brain here inside, and of course, obviously, it's going to be a little bit better here. But the idea is that when a person suffers a concussion, let's say they hit this area of their head here, the brain, the force of the hit will actually move the brain forward and slightly and actually hit the base of the inside of the skull. And then, of course, as it hits this way, physics tells us that it'll also move this way and hit the back of the brain as well. And what happens is that these areas of the brain have connections, have threads that connect it through the meninges to the skull, and these can tear, and these neurons can become damaged and break. And we actually find that a lot of times these concussions can be what we refer to as sort of invisible injuries, because they you can't really see a lot of times the injuries on an MRI scan, but we know that injury is there. And then when we look at what can happen in terms of memory loss, of course, if you go through and you have a particular kind of brain damage, we can actually see whether it's a concussion, whether it's trauma, whether it's a car accident, whether you hit your head, whether it's, medication, whatever it may be, we can actually see cases of amnesia happen, which is severe memory loss. Now, there's two major kinds of amnesia. We call it retrograde amnesia and anterior grade amnesia. And so I'm going to draw sort of a timeline here. And so this would be at the point of injury. So this would be injury. And then this would be everything before the injury, and this would be everything after. And so retrograde amnesia is when you forget everything before the event. So you forget who you are, you have a hard time remembering episodic memory, you need, you maybe forget your name, you maybe forget where you live, you maybe forget where you're from. This would be sort of the typical soap opera example where a person has an injury, they hit their head, and they're in like a different country, and they wake up and they don't know who they are, so then they start a new family, and then slowly over time they remember who they are again, and they're like, uh-oh, I have two families. A lot of times with people with retrograde amnesia, they may actually get those memories back, and over time they may remember who they are, especially if a person's got a head injury and the acute phase, so right after the injury, they may forget who they are for like a day or two, and then slowly over time these memories start coming back as their brain starts healing. We can also have something called anterior grade amnesia, which is they remember everything that happened before them, and then there's the injury, and then they can't remember anything new. They can't form new memories. If you've ever seen the movie 50 First Dates, this would be an example of anterior grade amnesia. This is not a common type of amnesia, of course. This is specifically damage to the hippocampus, which is an area of the brain that's important for consolidating new memories. And so this, of course, is very problematic for a person. They can have what we refer to as, a 5-second memory or just a few second memory. And they remember everything about themselves, but they're not able to formulate new long-term memories. There's a very rare case that we're going to talk about that is a case of anterior grade amnesia that we'd like to talk about, and the person is called HM. And so HM is a very famous patient, very famous case study, and this person was, for the longest time, we as the psychology community didn't know who he was. His identity was protected because he was still alive. He was a case study that many papers were printed on and talked about, and they had him do lots of different kinds of tasks. And what happened was HM, when he was about 9 years old, he was hit by a bicyclist. And he hurt his head very badly, jarred his head really badly, and then not long after that, he started developing seizures. Now, we've talked in the past that anytime you get a head injury, if it develops scar tissue on the brain, of course, there's a possibility of it being sort of a focal point for seizures, and then seizures can spread from there. Well, as Henry, what we learned later that HM was Henry Molaison. As Henry grew older and entered into adulthood, his seizures and his epilepsy became so bad that none of the medications that he tried worked. He couldn't work. He felt like he couldn't have a life. And so what ended up happening was he agreed to this surgery that would remove his hippocampi, which are the sort of like seahorse-like structures that now we know are important for consolidating long-term memory. Well, at the time, we did not know that. And so if you look here, there's actually these areas here where we can see that both, we call it bilateral, these structures are removed from HM's brain. And these were the inner medial temporal lobe areas, the hippocampi on both sides. And then there was a little bit more removed. If you look into this a little bit, there's a couple of videos that I have and some links that you can find out even more. HM had a little bit, a part of his amygdala removed on one side, but the bilateral hippocampi were the major structures that were removed. And what ended up happening was we didn't realize this at the time, of course, that these structures are so important. But once they were removed, HM no longer was able to form new memories. And that told us, okay, that these were very important. These structures were very important for the consolidation of new memories. And that when you remove these structures, you lose this, what referred to as episodic information, memories about yourself, new memories about yourself. He also wasn't able to create new general knowledge or semantic information. And so he remembered everything before the surgery. He remembered everything about himself, but he could not remember anything new. And so this really limited his ability to do anything. He wasn't able to have a job. He was studied all of his life by Milner and Corkin, and he was forced to kind of, just kind of live in the moment because he was not able to actually create new memories. And so there was, what was interesting though, so if you introduced yourself to him and he was talking to you and he was actively participating in conversation and knew who you were at the moment, then he would continue to know who you were. And if you gave him information to rehearse, he used his short-term memory and working memory. But as soon as he stopped rehearsing, it was gone. As soon as you walk out the room and come back in, he has no idea who you were. And he was able to, interestingly, retain a little bit of information that was surprising. One was that he was able to retain some residual declarative memory about famous people. So he was actually able to remember a few things about that. Another thing is that we found that procedural memories were intact. So there's task where you draw a star and you use a mirror to copy it. So you're actually looking at the mirror, not the star. You're looking at the mirror and you have to use the mirror to trace the outline of the star. Now that sounds simple, but when you actually try it, it's very difficult because remember, everything is sort of backward and flipped with a mirror. So you have to kind of remember that left is right, right is left, up is down. And so it becomes very difficult. And typically when people try it, it looks kind of like this. They're like all messed up. They're like, where am I going? And so, when HM was trained on this for several days, he actually could not remember training on it. They just gave him the task, showed him how to do it, and then he ended up doing it. And over time, he got really good at it because his procedural memory was kept intact, his memory for being able to do motor things and skills like that. And so he would actually say when he finished the task, wow, I'm really good at that. Like, I got that the first time because he actually had no recollection of practicing this. And so he had a few residual things that were kept intact. Now HM died in 2008 and and he donated his family donated his brain to science. And there's so we found out his name was Henry Gustav Malaise, and we found out all this information about him. When I was an undergraduate, I just knew him as HM. He was still alive, and he was somebody that, that we talked a lot about. But for us, he was just HM. So we learned that later that he was, after 2008, after he died, and, because he didn't need to be confidential anymore, we could learn about his story. When he died, there was a team that actually took his brain and they sliced it into 2,400 microthin slices in a 3-day session. And this is the website here. This YouTube link will actually show you, this is just a portion of, I think it's like a 10-minute portion of them slicing the brain. And so they took the brain out and they froze it and then they sliced it into these tiny little slices so that they could put together an atlas or a map of his brain and actually, be able to see what the damage looked like and see, and look at the structures and things like that. So it's a pretty cool video. You only need to watch like a couple of seconds of it before you see kind of, you get the point. This right here, this link here, and I want to kind of make note that this part doesn't work anymore. If you go to brainsociety.org and then click on patient HM, like the link that's on there, it's a different backslash, it's a different link. But it's a really cool site about his life and his brain, and you can actually order a book of his brain. You can actually order the atlas. It's really, really neat if you're into that. That's a pretty cool story. And then here, this video right here is Corkin talking about HM's brain after he had died, talking about the damage and looking at the surgeon, talking about how the surgeon, excised parts of his brain and found that he actually took out more than he had anticipated. And so this is just a really interesting sort of little talk on Corkin's work with Henry. And of course, Henry, worked with these scientists for a really long time, and would have to be introduced to them every single time. He remembered the surgeon who did his surgery, because he met him before the surgery was done, but he actually had no idea who the people who he worked with were, because he couldn't remember who they were. And so if we look here, what's really important here is remembering that these are the hippocampi here. So we have two of them, they're bilateral. And that's important for consolidation of memories. So that's transferring new explicit memories into long-term memories. The amygdala is important for emotion and the emotional aspects of memory, the feelings that you get when you think about memory. The under part of the medial temporal lobe, of course, this is which you'd have to kind of go up under the brain, is important for encoding and transferring those long-term memories. Also a part of the hippocampus area. The cerebellum is important for movement. It's important for procedural memories. And the prefrontal cortex, of course, is important for higher upper level, sort of higher level thinking, like the sequencing of events in terms of memory. What memory goes first? What do I remember of this? And those things are, of course, those are something that's really important for the process of memorization and recalling memory. Now, one thing I like to talk about here, when we're talking about just memory in general, is this idea of dementia and Alzheimer's disease. Now, dementia is sort of what we refer to as kind of like a umbrella term. It's kind of the all-encompassing general term for memory loss and disease and neurodegenerative disease when it comes to memory. But Alzheimer's disease is a kind of dementia. It's a neurodegenerative, progressive disease. It destroys the brain's neurons. It impairs memory, thinking, language, other kinds of cognition. It's a really, really terrible disease. And it can actually result in the complete inability for you to be able to care for yourself. It's the most common form of dementia, but we don't really know what causes it. There's a few theories here. So one is that it's a third type of diabetes, and that it's a issue with glucose and glucose control. And so that's one theory. Another very interesting theory is that's a terrible head, sorry. One other theory is that it is caused by a virus. And so if you look, so this is like a person's eyeball here, right? And this is a person's nose. If you look at the damage that Alzheimer's causes, it actually shrinks the brain. It actually causes the brain to atrophy and the neurons to die. When you look at a virus, viruses typically come through the nose, and they kind of travel in a way that's kind of this direction here. And if you look at the damage in Alzheimer's brain, it kind of follows this path in terms of the shrinkage and how that occurs. And so the idea is that Alzheimer's might actually be caused by a virus that one gets when they're younger, and then it either lies dormant or just very, very slowly over time does damage. And then, of course, it's sort of triggered by something, and that kind of escalates it. And so it ends up really harming a person's brain. And so this is something that is a theory. Like I said, there is, several theories. There are several theories about what causes Alzheimer's disease. But remember that, it's usually something that starts around 50 or 60 years old. Alzheimer's disease is not something that, it's not a form of aging. This is not a normal aspect of aging. This is not if you get old enough, you're just going to get Alzheimer's. That's not the case. Alzheimer's disease and dementia, these are something that's actually happening in the brain that's not normal. It is a neurodegenerative, meaning progressively worse over time in the brain, destroying the brain over time. It is a disease. And so we know that Alzheimer's disease, we see these extra proteins, these structures in the brain. We see these beta amyloid plaques, neurofibrillary tangles. And these extra proteins in the brain are actually gunking up the brain. And so because these structures exist, they're taking up too much room, and so they're waste products. And so another theory is that it's actually a sleep issue. And so individuals, we've linked, and this is correlational, so we can't say for sure, but we actually notice that individuals with Alzheimer's, they tend to have a pattern of poor sleeping that spans for decades. And so one theory is that these individuals who do not get enough sleep, who do not allow themselves or able to get the sleep nightly over the course of many, many years, to get rid of those brain waste products that we accumulate during the day. If you don't allow your body to do its proper course for decades, then the idea is that these structures can actually accumulate, and it just becomes too much of a problem, and your brain's not able to clean it out. And so these plaques and tangles are causing, major issues over time. And so that, of course, is one particular theory. But when we talk about Alzheimer's, we see, of course, it starts out as early dementia, this mild memory impairment. You start forgetting a few things, but it's usually manageable. But then progressively over time, it becomes much more pervasive, much worse memory loss. You start to get confused. Then what the next step is, sort of like this internal brain damage just becomes so widespread and so hard to manage that the individual might have day-night reversal. They may have what we refer to as sundowning, which is when you become very confused when the sun goes down, and and they get very upset, very angry. And what we find that doctors tend to try to prescribe people with Alzheimer's melatonin because they want to be able to help with their issues with their circadian rhythm. But the problem is that if the areas of the brain, for example, the suprachiasmatic nucleus, the hypothalamus, if those areas are atrophied or damaged because of the dementia, then the melatonin won't work, because those structures of the brain are actually damaged so much that extra melatonin isn't going to do anything for them. So that can be really problematic. At some point, the person loses the ability to communicate. They lose their sense of self. They don't know who they are. They don't know who the people are around of them. They don't know where they are. They don't know what year it is. They don't know what's going on. And then over a period of time, of course, we see that they just become incapacitated. And they can die just from that. Or if we see, of course, in cases of people who get pneumonia, they become hospitalized, or they have to go live in a nursing home or assisted living or a facility to take care of them. They may get sick. And they may get ill, they may forget to eat. We see that a lot, of course, in patients with dementia and Alzheimer's, is that they've forgotten that they've already eaten, or they forget to take their medication. That's usually kind of a major issue where we need caretakers to take care, to make sure that they're taking their medication, to make sure that they're eating, because they forget not only how to eat later on, but they forget that they've eaten or to eat, and they can kind of waste away. So this is a very, very awful kind of disease, and if you've known anybody or seen anybody or family member with it, it's very it's a very difficult disease to manage. But to kind of end on a little bit higher note here, let's talk about some ways for you to boost your own memory when it comes to studying, when it comes to doing something for yourself. So when we look at this here, if we're looking at, studying, you want to commit the necessary time to actually studying. Rushing it, not allowing yourself enough time, of course, means that you're not going to encode it properly. You want to encode organize the information in a way that makes it easier for you to encode. Do something that is going to be meaningful to you. If you're a very visual person, you like colors, color code stuff. Elaborate on the material. We talked about some elaboration techniques, and I'll talk about one more in a minute, which uses actually visual imagery. We'll talk about that in just a second. Explain it to a friend. If you can explain it to somebody and you've got it down, then usually that means that you understand it better. You want to reduce interference, meaning that you know, want to focus on the information at hand. Try not to confuse yourself with past information. Don't add in new information that's unnecessary. You can counteract the serial position effect, because remember, that's when you tend to remember more things at the beginning of a list and at the end of a list. You tend to remember more things at the beginning of your study session, at the end of your study session. But if you can highlight things in the middle and isolate them, then you're going to be much more likely to be able to remember those other things. You can use context cues to jog your memory. Try to give yourself little cues, retrieval cues here and there that can help jog your memory for studying or for, you know, just in your life in general. Mnemonic devices, this is really helpful for remembering lists and remembering things like studying, if you're studying. So for example, I'll use one technique. I might have covered this in class, but I'm going to talk about this again. The method of loci. So the method of loci is a mnemonic technique, and a mnemonic device is just, you know, sort of anything that you can help to, it's an aid, a strategy to help aid memory. So for example, please excuse my dear Aunt Sally. This is you know, the order of operations. And so that's a way for us to remember that. Or PEMDAS, a lot of people will remember it that way. Well, method of loci is an example, is a technique that we can use for using visual imagery. It's a mnemonic device. And it's a interesting kind of technique to remember something by visualizing it at a specific location. So for example, let's say you're trying to remember the Egyptian pharaohs and you're thinking about your table at Thanksgiving, and let's say your dad sits here and your grandma sits here and your grandpa sits here and your mom sits here and your uncle sits here and your aunt sits here and whatever and so forth. And so maybe you're trying to remember all the pharaohs, and so maybe you put the oldest pharaoh here because that's where your grandfather sits, and his wife you would put here, and then the next pharaoh maybe you'd put here, and then, you know what I mean, and so on. And so by actually visualizing where they're sitting at your Thanksgiving table, you can be more likely to help remember that particular series of pharaohs and in order. And their names and whatever. So that's just a kind of a visualization technique called the method of loci that you can use to help yourself with that. And so finally, but most importantly, this right here, this sleep on it. Help give yourself, your brain, the time that it needs to consolidate those memories. And in order to do that, you need to sleep. You need your brain to do those processes. And one of the processes that it does while you sleep is consolidating memory into long-term memory. And there's actually a very recent study that just came out like a couple of weeks ago, reiterating this and re-providing even more evidence to say that this is an important process. And we're getting even more specific about what brain areas are important for consolidation. So finally, this is just a review slide for you guys to help you with this particular quiz, just to kind of go back through, because it's been a little bit since, you know, before fall break in this class where we talked about some of this memory information. So I just want to make sure you guys will have it all sort of in place. So use this slide to help you with the quiz. If you have any questions, you know you can email me. I hope you all have a great rest of your night.